Hello, I'm Dr. Jonathan Amspacher. I'm the Director of Plastic Surgery for Mosaic Life Care, and I wanted to take a minute to talk to you about a question about what's involved with a tummy tuck. It's something that we hear folks ask very frequently, and it's a good question because there's actually a lot involved with a tummy tuck. A tummy tuck can be a very rewarding procedure and make a really dramatic difference in a patient when they're done at the right time, under the right conditions, by the right surgeon. And so when you're going for a tummy tuck, you want to think about a couple of things. You want to think about, am I at a good point in life where I can afford to have a little downtime, where I can have good recovery, where I have good support structures and things are pretty stable in my life and my health is pretty good. Tummy tuck can involve a couple of things. Frequently, of course, is the abdominal resection of tissue, which is called abdominoplasty. Sometimes we'll add adjuncts to it, such as liposuction or other body contouring techniques in order to improve the overall outcome. And so those are things that you'd want to talk to your surgeon about if you think you would be a candidate or interested in doing those things at the same time. Tummy tuck classically removes tissue from the lower part of the abdomen. So what it does is it resects excess sagging skin and fatty tissue below the belly button in many cases. And then the belly button is shifted to a higher position on the skin as they pull down the skin from the upper abdomen. What this does is allows us to really reshape the abdomen and give folks a much better, more pleasing appearance. We also have the time that we can tighten the rectus muscles. And the rectus muscles are those vertical up and down muscles that give patients a six-pack. And so what happens though is when those fascia between the muscles get stretched out from increasing intra-abdominal contact, such as when you have children and childbirth or excess weight, those things can stretch the fascia. And even though you get back into shape and you really tighten the rectus muscles back up, unfortunately the only way to tighten the fascia back up is with the aid of a surgeon. And so what we do is we actually stitch the fascia and the muscles back together in order to tighten up the rectus diastasis is the technical term for it. And this gives you a much tighter, much flatter, much firmer appearing abdomen. And that's what the real goal of tummy tuck is. It improves the abdominal contour. It doesn't cause massive changes in weight, but it does cause massive changes in contour and body shape. It's one of our happiest procedures, and I think patients really benefit from it when it's done appropriately. Thank you very much for your time, and best of luck on your journey.